When performing CPR, you would want to have a minimum of 3 to 5 personnel staff that are already trained in CPR assistance. You would have one person establishing an airway, placing an endotracheal tube, another person getting an IV line ready for fluids, and then attaching monitors, and the person that's going to be doing the compressions. So if you do have that staff available, the way you would do the compressions is you would do the compressions for 2 minutes, and then you would want to breathe for them every 6 seconds, which is roughly 10 per minute. And you could use an ambu bag once the endotracheal tube is established. The way I would locate the heart, the area of the heart, is first by having my animal lateral recumbency. I want to make sure the table height's okay. You don't want to put too much pressure with your hands themselves. You would be placing them over the rib cage on the side here and bending at the waist while you're making your compressions. You wouldn't want to manually use your arms and elbows. So I would locate the heart by bending the elbow. Usually that brings it right to the level of where the heart is, or you could count ribs. I usually do 4 or 5. So I would just put my hand on the side here, my other hand on top, and I just count. Since I am by myself, I'm going to do 30 compressions with 2 respiratory breaths. So I just gently start my count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then I'd get the muzzle and make sure I don't have pressure on the chest. And I just take 2 breaths. And I want to make sure I create a seal when I'm doing that, so that I make sure the chest is rising and I'm not giving too much pressure. I'm going to continue back to doing the compressions. All right, and then I'm going to give 2 more breaths. Now, if the patient was intubated, I would go ahead and do breaths with the ambu bag, and you could visually see that the chest is rising when you're, giving a breath. If IV medications are necessary, like epinephrine, when you push them, you just want to make sure that you're able to give 20 to 30 mils of flush after it, so that the medication reaches the heart. Thank you.